I'm Professor Mark Batt. I'm a consultant in sport and exercise medicine. I work in Nottingham, Nottingham University Hospital's NHS Trust, and I also work through the National Centre for Sport and Exercise Medicine. I run a young person's sports medicine clinic on a Friday morning, and I have children, young people coming to me with their parents. And often we get asked, having sorted out their injury, about how much activity young people should do. Parents can be helpful with that, helping walk children to school, playing with them in the park, organise sport too. But it's important for young kids to be moving and not be sedentary. And we know that's good for all sorts of things, whether it's concentration in school, confidence, social interactions, strength, balance. There are a variety of reasons why this is good, let alone future health and helping with weight control and trying to prevent the increase in childhood obesity, which is occurring in our communities today. And whilst you're with your child exercising, of course, it's great for adults, for parents to be physically active too. Parents too have physical activity needs, and we need to remember that. The key message is for young people to be active every day. 60 minutes of activity, some strengthening work, some balance work, some aerobic work is all important, and it can be accumulated in small bouts throughout the day. It doesn't have to be an hour of solid activity, and indeed that's sensible because kids are not mini adults. They have different physiology, different makeup, and they like short burst activity. From a practical point of view, aerobic activity effective for your kids means running about. It doesn't have to be organised sport, of course it can be. Strength work does not mean taking young children into gyms and subjecting them to weights programs, but it's using everyday tools, everyday playthings that we have to encourage them to move and use their strength and increase strength. But this is not getting kids to be young bodybuilders.